welcome back to this episode of This Healthy Life podcast. Very excited for my guest today. I have Dr. Scott Noorda, and he is here to share all about one of my favorite topics, brain health. So I'm so excited to have you on. He specializes in functional and precision medicine, and he focuses on brain health, Alzheimer's, and longevity. So Dr. Scott Noorda, so happy to have you here today. Thanks for joining us.
Thank you, Erica. Excited to be on.
Yeah, absolutely. So I'd love for you to start with a brief intro, sharing a little bit about yourself and how you got into the space.
Sure. Yeah, I'll try to keep it brief. So it is a bit of a story, but I was interested in brain health. In fact, before going to med school, I thought I wanted to be a neurologist or neurosurgeon. I studied neuroscience in my undergrad at BYU and loved it. And then just wasn't the right fit for me. I seemed to fit better in primary care. I liked that kind of connection relationship with my patients. And so I went into that and quickly realized during my residency that there was something missing. And by the end, they tried to ramp you up to see enough patients. And I just didn't feel like I could make a difference in people's lives in 5 to 10 minutes. And so started looking elsewhere, ended up in North Carolina for my first job doing house calls and also working in facilities like assisted living and memory care places. And loved that, being in people's own kind of living environment and getting to know them, but also kind of working with end-stage chronic disease. I also saw a lot of the failures of our current healthcare system, right? Just people on lists of medications that are all appropriate for their diagnosis, but aren't, and may be prolonging their life, but aren't necessarily making their quality of life any better. And so I was in that realm when my dad was diagnosed with Alzheimer's disease. My mom called up one day and just said, "Hey, just got this diagnosis from Dad's neurologist." And it was a big kind of slap in the face because I really didn't have much to offer. I had studied Alzheimer's disease for the last 10 plus years, and neither his neurologist nor anybody else really had anything to give him. Just kind of said it's going to get worse, and plan for the future. And so that was tough to handle. And so kind of hit the pause button on my career trajectory and actually moved back to Utah from North Carolina. I got my parents settled down here in southern Utah, and then started to look into what else was out there and found Del Bredesen and his research on Alzheimer's disease and the Scherzai's doctors, husband and wife doctors down there at Loma Linda, and just little by little started piecing together that there was quite a bit of information out there as far as research goes, but not in the conventional realm or not available to most providers. And so yeah, that kind of steered me in this direction. I gathered a bunch of information. I was super excited, dumped it on my parents' lap and said, "Here's what you need to do." And it was just too much. They were quickly overwhelmed. And so we had to step back and figure out how to help people prevent this condition from an early point. And so, yeah, that's why I do what I do. I got into functional medicine, trained by the Institute for Functional Medicine after family medicine board training. And now we see people doing lots or dealing with lots of different issues, but my passion is certainly brain health.
Mm-hmm. Amazing. Yeah. Such an important topic because, like you said, there's so many things that we can be doing when we're younger before we start to have brain issues. And there's so many things that are already affecting our brain and cognitive ability that people don't even realize, causing issues for them. So really kind of trying to track that and be aware of that is so important. So let's start by deep diving into Alzheimer's, just because that's kind of like the end state, right? Where a lot of cognitive issues happen. So Can you talk about some of the early signs that you might be experiencing if you're heading down that road? Like what sort of cognitive issues might someone be having or showing that they can maybe catch early and not have it progress to such a deep condition?
Yeah, for sure. In fact, I just did a reel on Instagram about kind of top 10 unexpected signs of Alzheimer's disease. And I did it because most people think, yeah, I'll notice when I have significant memory decline, but a lot of people don't realize, number one, that they're having memory decline, and there are symptoms that happen so much sooner than that. So one thing that people don't realize is that smell, our sense of smell, is one of the earliest signs as far as sort of subtle changes in sense of smell. The research has focused more on smells like coffee or cinnamon or things like that are pretty easy to detect, but not overly powerful or overpowering, I should say. And so that's one way that you can kind of notice. Obviously, COVID has gotten in the way of that with affecting people's smell and taste, but that's one way. Another early warning sign is actually tied to neurodegeneration or neuroinflammation. Is effects that it has on our gut and bowel system. So usually it slows down the transit time, and people end up with some degree of constipation as one of those earlier warning signs.
Mm-hmm.
And then
Which
things
that's
that
becoming a harder one too, with everyone being on GLP-1s now, right? It's like these two
that's
top
true.
kind of signs are dwindling down as early warnings.
Yeah, that's a good point. So other things to pay attention to would be if you have a harder time navigating. So, places where you go often or you spend time often, you might notice that it's harder, or you forget a certain turn or something like that. One that people do think of often is forgetting why they went somewhere. So going into another room, forgetting why you went in there. That's a pretty common one that we hear from people. One thing that maybe you don't think of a lot as an early warning sign is sort of emotional personality changes that are pretty mild at first. So it might be one of the things that is showing up in the research is kind of a change in your ability to connect emotionally really well with other people, or showing your kind of concern or emotional concern and insight into somebody else's problems. So that's one thing that spouses often pick up on early on. There's some speech changes, quality of speech, and some of the research now, as far as trying to look at early detection, is looking at some of those speech pattern changes. So slight alterations in somebody's speech might be an early warning sign of that. So those are some of the early warning signs that maybe people aren't thinking of as often.
Mm-hmm. And a lot of times, when do these early warning signs start to happen? Like, is this something that happens like in your 40s or 50s, or is this something that starts happening sooner that you should start to be aware of these things? Because I mean, I feel like everyone walks into a room and forgets what they're doing every now and then, right? But is this something that's just kind of happening more and more often, more frequently? And is there a certain kind of age bracket that if this is happening more often in this age bracket, that's a big red flag that something's happening?
Yeah, that's a great point. And I'll mention one more and then I'll answer that question, which just difficulty learning new things is another one that is really good to be aware of. So somebody who's still working, for example, and they're given new tasks that they're not typically doing on a regular basis. That's another one we see often, where they say, I started to realize I couldn't pick up on things that usually I'd be able to pick up on quickly.
Yep.
So learning new things is really a big one. And that, any of those can happen. We know that the pathology that's starting to happen inside the brain, some of those changes are happening decades before the typical symptoms are starting as far as memory goes. Some of these more subtle signs are maybe happening 10 years before kind of other symptom onset. 5 to 10 years, I would say, is pretty typical. But again, most people don't notice until the memory symptoms start, and then we kind of dig back into their history and realize, okay, maybe this was kind of that early warning sign.
Yeah, that no one picked up on. Yeah, absolutely. And then, so let's talk about Alzheimer's versus dementia. I think those are like two words that get thrown around a lot, right? When people are aging and having some cognitive decline. Can you kind of break down what the difference is between the two and what the overlap is?
You bet. Yeah, so dementia is the umbrella term of pretty much everything cognitive decline related. Mm-hmm. So that means memory loss, any type of memory loss is under that umbrella of dementia. Mm-hmm. And then Alzheimer's is the most common type of dementia. So that's kind of how that fits in. And then now we can kind of further subtype Alzheimer's disease thanks to more of the later research by Dr. Bredesen and others.
Mm-hmm. Okay, awesome. And then so you like to talk about something you refer to as the 6 types of Alzheimer's. So there's not just kind of one bucket or one branch that everyone presents equally the same, right? So what are kind of these different types or different buckets? Are they different symptom sets? Is it that they start at different ages, or what exactly does that mean, and how do you differentiate them?
Yeah. So that's a really important point, and something that kind of blew my mind when I first realized it, because and maybe explains why we haven't made a ton of progress in this area. Is our healthcare system is set up, as far as from a research standpoint, to look at one underlying cause equals one condition, right, or diagnosis. And so typically when you're doing a randomized controlled trial, you control one variable, you have a control population, and then you kind of see what happens with that, right? And unfortunately, with with Alzheimer's disease, drug after drug after drug have failed as you've tried to deal with amyloid plaque or other things that look like they're the cause. And this is, I think, one of the reasons is because there are multiple subtypes of Alzheimer's disease, or types of Alzheimer's. So let's go through those. The number one is inflammatory subtype. And that would be typically caused by or triggered by some type of underlying infection that kind of changes the way our immune system is functioning. And then it activates the microglia in the brain, which are kind of our brain's immune system. And then the downstream effects would be that beta amyloid is starting to clump together, and you see these amyloid plaques. And that's what we thought was causing the problem. Actually, it's part of the brain's innate immune system that's trying to protect that, whatever's triggering that inflammatory response. So inflammatory is number one.
Mm-hmm.
Number two
seems to be the root cause of everything, right? It's always like always inflammation.
It's so true. Yeah. If you ask me what causes anything, yeah, pretty much inflammation is at least involved in that process. Mm-hmm. Some change in our immune system, where instead of turning on acutely and then turning off appropriately, something just shifts there, and now it just stays on.
Yep.
Right. So yeah, inflammation is definitely involved. And we talk about these 6 subtypes as sort of unique subtypes, but in my experience, it seems like there's overlap usually in individuals with 2 or more subtypes quite often. So inflammatory is number one. Number two would be atrophic subtype. So trophic means growth. A means no growth. So it's lack of growth factors to the brain. And that would be kind of the more typical type of Alzheimer's disease. Inflammatory seems to come on a little bit faster symptom-wise and progress a little bit more rapidly, where atrophic seems to come on very, very slowly. And lack of growth factors means nutrient deficiencies. So that might be B12 or folate deficiency, or that they're not processing it. So a methylation deficit that doesn't allow them to use those B vitamins. It might be copper and zinc and vitamin D and other nutrients, omegas and healthy fats, or it might be hormone related. All of those kind of serve as growth factors for the brain. And that's why we see a significant bump up in cognitive changes in women, especially after menopause. So risk of Alzheimer's disease and dementia is much higher in men before that age, and then after menopause, women rapidly catch up to that with men. So atrophic is an important one. Again, slow onset, pretty slow progression.
You hear a lot of women that are like in menopause being like, having short-term memory issues or brain fog. Like I have one friend that she's just like, yeah, I put like milk in the pantry instead of the fridge. Like, what was I doing? And it's like, you just hear all these stories of just your brain is just not quite firing correctly when you kind of hit that hormonal shift in your body. So that makes a lot of sense.
Yeah, it's so true. And we see that a little bit with like pregnancy, that sort of mom brain issue that is a real thing. We've actually seen that on imaging, and that seems to sort of be magnified after menopause as you lose that stimulation. And then a lot of women can kind of regain that, or their brains do okay as far as recovery goes, as they kind of adapt to lower levels. But if you have, genetic predisposition or significant hormonal issues, maybe in combination with other risk factors, then that's where it's really going to cause problems. And then, the next subtype would be what's often considered type 3 diabetes. So that's that glycotoxic is what Dr. Bredesen calls it, that high blood sugar, insulin resistance, metabolic dysfunction, where your body has the glucose there in the system, but it just can't process it appropriately. And the high glucose levels then damage the brain, and there's an energy deficit. So it's that whole combination of glucose or damage from the glucose, excess glucose, but especially this insulin resistance throughout the brain causing energy deficit and mitochondrial issues. So anyway, that one's certainly a big one that we see. And often I'll get people who are saying, oh, I just heard that, Alzheimer's is caused by blood sugar issues. And there's definitely this subtype. It's not for everybody. I would say maybe half of the people that I see have some degree of insulin resistance or metabolic dysfunction within that process. So it's definitely common. And then we get to toxic subtype. So that's one also that through medical school, they don't really teach us much about, and residency as far as toxins go, and learning about mold and heavy metals and environmental toxins and how these penetrate, can access our brain get through the blood-brain barrier, and they tend to, they're lipophilic, so they tend to kind of hide in our fatty tissues in the brain. And then those tend to kind of trigger often that inflammatory process in the brain. These people often aren't, they don't have the genetic risk factors. Sometimes they do, but often they don't have like the ApoE high risk 4 subtype and or allele. And so they're kind of like inflammatory, but maybe even worse. They come on fast, usually younger age, and they progress very rapidly. And their symptoms are often a little bit different, kind of unusual compared to the typical just progression of memory decline. So they may get more agitated. They may forget, their mind may, as far as kind of how the brain is functioning, it's often not just the typical kind of short-term memory loss. It develops into a lot of other personality and other mental status changes. So yeah, that one's pretty aggressive depending on the type of toxin that's in there.
I'm glad you brought that up about the genetics, because that was actually something I was curious about. Like, do you have to have, I don't mean to segue from our types, I want to get back into that, but do you have to have the gene to develop Alzheimer's, or it sounds like you can develop it without it, right?
Yeah.
Okay.
You can definitely develop it without it. I would say most people end up having at least one copy of the ApoE4 unless they are exposed again to significant toxins, and that kind of triggers that toxic subtype, or another major inflammatory issue with, and in that case, there are usually other kind of genetics at play that deal with, again, shutting off that inflammatory process. So yeah, I do think genetics are important. That ApoE4, the one that everybody thinks of for high risk Alzheimer's, you don't have to have it. One copy is what I have, and what certainly motivated me to kind of figure out, hey, I need to know how to prevent this for myself. But also 2 copies, dramatically increases 10 to 15 fold increase in your risk of Alzheimer's disease. So,
and then if you get exposed to some of these environmental toxins and things like that, then that ramps up another route to already progress into that as well, right?
Right.
Yeah.
And people often ask me, and then I'll get to that the last subtypes that we were talking about. People often ask me, why would I want to know if I have this high risk gene if there's nothing I can do about it? And that used to be true. Honestly, it was more of it's a death sentence. So why would I want to know until it comes on? But that's not true anymore. It's really not. In today's environment, there's so much that can be done that the more you know, the earlier you know, the better. Because then we can identify the subtype you're at risk for and really kind of work with your genetics and just, completely change that kind of trajectory you're on. So getting back to the subtypes, the last couple subtypes we have are the vascular subtype. So we know there's a separate kind of vascular dementia, but even within Alzheimer's, there's a vascular subtype of Alzheimer's that typically is, impaired circulation, typically small, tiny strokes to the brain. You can see white matter changes on the brain on MRI. So that's one. And then the last one is the traumatic subtype, and that would be, repeated head injuries and traumatic brain injuries that we see in athletes and in high risk, high contact sports. So.
Mm-hmm. All right. Lots of stuff to be careful with.
Yeah, for
And then,
sure.
so I want to dive back a little bit into the first one, the inflammatory one. So you mentioned a lot of like underlying infections can, be the driver for that, obviously kind of turning on the immune system and things like that. What sorts of infections are you finding are triggering some of this inflammation in the brain and causing some of the cognitive issues?
Yeah, it's variable. There are more infections there than I expected there to be, honestly, when I started into this process. So one of them that we see, and the dentists are certainly aware of, it would be the infections in the mouth. So like gingivitis, the infections that cause gingivitis, um, those can certainly cause an inflammatory change that can become cardiovascular disease, or can instead go to the brain and cause this inflammatory process. There are other bacteria that can certainly cause it, but viruses, Epstein-Barr, for example, is one of those. I tend to think that with all the brain fog and cognitive changes we've seen with COVID, that's likely one of the triggers. We don't have enough research to see that play out just yet, but it certainly seems like that. So yeah, those mono-related Epstein-Barr virus, herpes viruses certainly can do that, especially HHV6. So yeah, viruses can do it, and then we see parasites in there. We see mold-related toxins, or infections. They kind of, mold fits within both that inflammatory infection subtype and the toxic subtype with the mycotoxins they release. But
Yep.
that gives a few of those. Yeah.
Yeah, so much, so much that, like you said, like Western medicine really isn't looking into these things and looking into toxins, looking into mold, and looking into these underlying infections, even in your mouth, which is so important, right? Because it's
Yeah.
like that's so close to your brain, it's going into your GI tract, and all these things that are being affected by it. So it's great
Mm-hmm.
that you're looking into that. So
Yeah.
very
Yeah.
cool.
It's really, tricky, I think, too, because if somebody goes to the doctor and says, "Hey, I'm having cognitive decline," most of the time they're not going to think, "Well, let's look inside your mouth and see what
Hmm.
your oral microbiome is like,"
Yeah.
or
And
and
hidden infections in the mouth too, right? I mean, there's all these people that get
exactly.
root canals and have wisdom teeth pulled, like myself
Mm-hmm.
included. So I had Lyme disease and my brain was severely affected by it. So I had such horrible cognitive decline from it. And I went from being a super high functioning person, like owning my own business. I had just finished my like licensing exams for architecture, which were no easy feat to pass. It was like 9 tests. And so I was like, my brain used to work really well. And I went to like not being able to drive, basically being bedridden, and like my short-term memory was completely gone. Like the brain fog was so severe, and like just the neurological issues were terrible. And by some miracle, I got better after years and years of treatment, and my brain works amazing now. Like I've really cleaned up my diet and cut back my inflammation, all the things. And unless I get accidentally glutened, that's the only time my brain really kind of suffers. But like sometimes that just accidentally happens. So it's been just kind of like a 180, but really got me intrigued into like what are all these different things that are affecting our brain and all these things causing inflammation. Of course I had mold, of course I had dental infections as well, but getting all those things out really did make a huge difference on my brain. And obviously like kind of calming down the inflammation from Lyme that was caused and all that, like it took kind of attacking all the things that you mentioned. So I think it's, that's really, if you're having issues with your brain, you really do have to kind of look at the whole picture and make sure you're addressing all those different causes, right? Because like for me, it probably wasn't just Lyme. It was probably a combination of the dental infections, the environmental toxins, and everything else that was going on. So
Yeah, I'm so glad you pointed that out, because often what we get, and I'm glad you mentioned Lyme too, since I didn't mention that before. It's certainly a common one that we see, but often we'll have people who say, "No, I thought that it could have been this infection, Lyme or mold or dental infection, but I treated that thing and that didn't fix it. And like you said, often what we see is once the floodgates open, whether it's on the toxin side, you get mold exposure, which then opens it up to other things your detox system can't keep up, and then you get overwhelmed with other things. Or your immune system gets impaired because of Lyme or because of Epstein-Barr. And then again, not the floodgates as much, but your immune system gets impaired, and that kind of allows other things to come in and wreak havoc. And so what we see is it's not just about treating a single infection. That's really important to get rid of that infection as much as we can, but then to look elsewhere and see, okay, what else has come in the meantime? And we need to address those. And even beyond that, now we need to address the immune system dysfunction that's happened, because that's really the underlying cause at this point. We can clear some mold or we can clear some infection, but ultimately you have to fix everything else. It's a process, right? And that's where, again, coming back to how do you do a research, like an easily controlled, randomized controlled research trial on something like that. It's just is almost impossible at this point with the way that our medical system is set up. And so, yeah, it's really important to see somebody who can kind of look at all of those different aspects and say, okay, now let's fix this part of your immune system, and now let's fix your detox system, and really kind of plug those holes, as Dr. Bredesen likes to say.
Absolutely. All right, so we talked about all the things that can go wrong with your brain. So let's shift gears a little bit and let's talk about all the things that we can do to fix our brain.
Love it.
And really kind of heal that. So I'd love for you to share kind of maybe some of your top methods that you use with your patients to like kind of support the cognitive decline, support the brain. Obviously you mentioned, detox, addressing some of these underlying infections, but what's kind of your approach to treating someone that might be dealing with cognitive decline?
Yeah. So step number one, like I mentioned, is identifying, right? So I think every person is unique. So stepping back to figure out, okay, what are your risk factors? What have you been exposed to? What has your lifestyle been like? All of those things. So step number one is kind of identifying most likely triggers. And then from there, you sort of working on them individually. But big picture, the first thing that I like people to understand is we want to make sure that we're going into the brain and taking out the things that are likely contributing to problems. So that might be the toxins we're talking about, and you might go through a pretty aggressive detox process of binders and sauna treatments and antioxidants and maybe even antifungals if you have mold. So there's that kind of removal process, toxins, infections, stress is part of that. Trying to take out the things that are problematic. And then next, we're trying to add back in the things that maybe the brain is missing. So those growth factors and support, nutrients and hormones, and also kind of giving the brain, putting it in an environment where it can regrow, right? Or we can stop the progression of that disease process. So take out what's bad, put in what's good and what's needed, and then train the brain. So that's what we do. So for each of those subtypes, that looks a little bit different, but typically you're putting in certain nutrients. So we use, depending on the individual, something similar to a higher healthy fat and protein, often plant heavy nutrition plan. It's lower in carbs. We take out certainly inflammatory foods, inflammatory oils and sugars, and processed foods as much as we can. And then we really want to have that on the higher end of healthy fats and proteins, and then tons of antioxidants. So we look at in our nutrition plan, we try to do it kind of based on F's as much as possible. So we do healthy fats, we do fiber, and sometimes that does include healthy grains. For some people, they want to eliminate those. For other people, they need the grains in there to have the prebiotics to build back up their microbiome. And so some of that's individualized. Flavor we use for like the antioxidants. So that's lots of spices and herbs. The more of those you can put in, the better. They're anti-inflammatory, antioxidant, really helpful for the brain. And then fermented foods are really important. So again, adding it back in the good gut bacteria. There's so maybe now we're starting to really understand that kind of gut brain axis and how much those microbes in our body do for our brain support and overall health. And so getting fermented foods into people's daily diets is really important, and something that's just not often eaten, at least not very much in our society. So that's an important one. We do some intermittent fasting with people. So the easiest way to do that is at least getting 12 hours overnight where you're not eating anything during the night. That allows that system, our detox natural cleaning system, to be able to start to work. And so
12 hours is enough to kind of
it's
be in a
not
fasting window?
enough.
Not
It's
enough?
not enough, but it's the
A
start.
good start. A good start. What's an optimal fasting window? Or
We usually shoot for 14 to 16. So if we can get people to 16 hours, this isn't for everybody. Some people have blood sugar instability and they just can't go that long. But if they can, and we can get them fueling on more healthy fats and proteins, then yeah, 16 hours is about where we try to shoot. And then some people do better. If they struggle with doing that every day, then maybe we do a 24-hour fast once a week or once every 2 weeks, or intermittent kind of longer fast, 36 to 72-hour fast. So,
and what are the
yeah.
things that you're finding with the fast that just kind of helps with like the autophagy and kind of clearing out that dead cells and things that shouldn't be in there anymore? Or what other benefits are you finding from people with cognitive issues fasting? Because there's a lot of things at play, right? Because I've dabbled in fasting, and like I can do like a kind of reverse intermittent fast window, kind of like what you recommended, like doing it during your sleep and just eating early dinner and a little bit later breakfast. Like I can pull that off. But
Yeah.
I tried doing the other one where you kind of wait to eat until 2 p.m. and it was just too much for my body.
Much.
Hormones got out of whack, and it was just like, so there's that whole cascade of things that you can kind of easily mess up with fasting incorrectly as well, right?
So true. Yeah. And again, you have to watch your blood sugar. And I would say women more than men tend to struggle if they aren't getting in enough calories or enough carbs. Sometimes if they go more keto and then they don't get enough carbs and then they try to fast, they
That's
really
that's my
struggle after a
mistake.
while.
I was doing very low carb and it was just like wasn't working.
Yeah.
My body was really angry with me. So
It does.
I
Yeah.
was
Then it throws
like,
off your hormones and everything else. So, yeah. So I don't know that there's like a one size fits all approach for everybody, but I do think fasting for most people is really beneficial as far as, sometimes we just fit in, like somebody needs a little protein and healthy fat snack at night and then they can make it through. My preference is to give 3 hours before bed for most people where they're not eating, at least 3 hours, and then starting the day with a good protein rich meal. That seems to make the biggest difference as far as blood sugar stability goes, and being able to maintain that. So we just watch. We start with smaller fasts, and then we kind of increase that over time and see how people do.
Yeah.
If they start to struggle even on the shorter ones, then we'll use a continuous glucose monitor and see what's going on. Are they dropping and spiking and dropping? And then maybe it's more of an insulin sensitivity, insulin resistance issue, and we work on that.
Absolutely. And then what about some other things? I mean, right now, I feel like creatine is all the rage for brain health, right? Like, obviously, not just for building muscles, but there's been so much talk about how it can really enhance your cognitive abilities, and it's a good supplement for your brain as well. What's your thoughts on using creatine as a cognitive enhancement?
Yeah. Yeah, you're right. It fits into that category of kind of mitochondrial support, and there seems to be a mitochondrial deficit in pretty much every one of those subtypes of Alzheimer's disease. But and honestly, in just about every chronic disease, that kind of fits into that. Inflammation's part of everything. Mitochondrial deficit seems to be part of just about every chronic disease out there. So yeah, creatine kind of helps your body make a little bit more ATP and energy production, and supports it in multiple different areas, and seems to support some hormone regulation for people and building up muscle. So yeah, I do use creatine quite often in patients and do find it to be beneficial. We'll often use other mitochondrial support, things like NMN, which is kind of supporting that NAD plus. NAD plus is like
Love NAD.
Yeah, NAD is kind of that
It's my new
common
favorite.
supplement. Yeah, people are using it as like patches or injections. NAD taken as an oral supplement, for a lot of people, they're not getting high enough levels. So you can use precursors like NMN or nicotinamide riboside, and then kind of boost your NAD that way. And again, these are all just kind of mitochondrial support. So those ones, a lot of people are using methylene blue in the same way.
Love that one too.
I think it has a lot of promise, and I'm kind of like back and forth with it right now, because there's just some interesting research that shows like what it's doing to our organs, and is that beneficial or not long term?
Is it turning us blue?
Yeah, from the inside out, right? And if it is, but it's still beneficial, maybe that's not a problem. And certainly if somebody's dealing with cognitive deficits, that's much lower on the list of concerns than other things. So
I think it's really good for like antiviral properties and things like that too, right? Like especially after like a viral infection, like fighting that fatigue, kind of resetting your mitochondria. I have found that it's really helpful for that, and just kind of resetting your body, building it back up a little bit. Yeah. So maybe not daily use, but as needed. If you're worried about the organ dying, not dying, but like dying as in color. I don't want people to think we're killing our organs here. We're just changing the color.
Right.
Want to make that clear.
So I think that's, it can be used in that way. Antimicrobial for pretty much everything. It seems like it kills off just about every bug to some degree. So
yeah, absolutely. So let's talk a little bit about, so when a patient comes to see you, you kind of identify these buckets, right? And say that they've gone through the protocol, they've detoxed the mold or whatever environmental factors were in there. They've, dealt with whatever traumatic brain injury they had to kind of heal from, and say they had an infection too, and that's cleared. Like, what's kind of the next steps for a patient like that? Like, is there things that they have to be kind of on like a maintenance program to make sure that they keep their brain healthy and don't kind of slip into this path of developing dementia or Alzheimer's, or do they not have to worry about it as much? Or what's kind of your take once a patient kind of clears these things that were kind of depleting them and putting them on the path to having these chronic conditions?
Yeah, the research is interesting. I want it to say that they just have to do that for a few months and then that it doesn't come back. And that's not what the research shows, unfortunately. You pretty much have to, once you are on that pathway of cognitive decline, you can actually kind of pause and even reverse symptoms and see changes in the brain and cognitive scoring and all of that, which is awesome. But if you fall off the wagon as far as no longer following a nutrition plan, good exercise plan, kind of doing all the things from a nutrition, lifestyle, supplement, brain training situation, you really see those symptoms start to creep back within sometimes weeks, definitely months though. So,
and then, go ahead. Sorry. Was there anything else you were going to add?
Yeah, I was just going to say, I didn't mention before, but certainly exercise is a big part of this.
I'm glad you brought that up.
Yeah, it increases BDNF, that brain-derived neurotrophic factor, another major growth factor for the brain. And so this is one that we'll see as cognitive decline continues, that people's ability to kind of engage in really good, meaningful physical activity starts to go down. And then their taste changes, and we talked about smell, and the bowels are changing, and so then they don't crave good foods, and they don't like to eat good, healthy foods, and it kind of becomes this spiral of the body not wanting to. It feels like the people don't want to or aren't able to engage in the same changes, and so again, that's why there's such a critical window where if we can catch them early or before those changes start, then you can really reverse a lot of that. But so yeah, it's exercise, stress control. We talked about if cortisol levels are staying high or they're super depleted, that also wreaks havoc in the brain and overall balance of other hormones and energy, metabolism and availability. So stress is a big part of that. And just, some people think I don't have that stressful of a life, but when you dig in, you start to realize that they've just always look at things from a little bit more anxious perspective. Or they've had a major trauma, and that's just kind of replaying in their brain over and over again. That can kind of trigger that response. So stress, optimizing sleep is a big part of it as well. And sometimes that means you have to be on oxygen or even a CPAP machine, or we usually start with like taping the mouth and trying to optimize oxygen and breathing during the night that way, and using other nutrients like magnesium and L-theanine and other things to kind of bring in good, meaningful sleep. But that's a part of it. And then another thing that people often do is they start to socially isolate a little bit. Sometimes it's because they don't hear as well. That was my dad's kind of initial trigger. For a lot of people, it's hearing that then leads to cognitive issues. But whatever it is, if they don't hear well, if they're not quite processing well, or they're worried that they're going to get caught in a conversation where they don't know the answer, they start to socially isolate a little bit and then a little bit more, and that just exacerbates the problem. So we basically push people to do all the things that they don't feel comfortable doing, right?
Yeah,
So
absolutely.
we encourage them to form and maintain meaningful relationships and social engagements with people. Cold plunges actually are another one. That cold water kind of getting in there and stimulating that kind of immune response is really helpful. So yeah, those are some of the things that we do. And then long term, we definitely kind of provide ongoing support and continue to recheck labs and make sure nothing else is slipping.
And then are there certain exercises? I'm glad you brought that up because I think that's such an important part, like both like aging gracefully, longevity, and cognitive health as well, right? But are there certain exercises or workouts that you recommend that are better for your brain versus others? Like, should we be strength training? Should we be doing cardio? Or should we be doing something a little bit more passive as we age? Or what sorts of things are you finding are helping our brains the most?
Yeah, this is another one where, it depends on what research you look at. And I think everybody who has a passion about a certain type of exercise can point to a specific study and say, this is the reason why I need to do this type of exercise.
Right.
Because strength training, yes, for sure. We know that strength training is really important because it increases mitochondrial makeup in our body, right? The more muscle we build, the more mitochondria we have. That improves insulin sensitivity, so it decreases insulin resistance. It's really, really important. And it just, for longevity, it's one of the most important things we can do. So strength training, yes, for sure. But even like yoga and balance training, really helpful for brain stimulation. And that's one of the things that tends to decline quickly and early on in the movement side is kind of your balance. And so being able to do that type of training is really helpful for the brain. There's research showing that just walking does as much, if not more, than more aggressive, high-intensity exercise for long-term cognitive benefits. So I would say the take-home for me is the more variety you can do, the better. If you can do it outside and kind of combine it with multiple things, you're maybe talking with somebody else, so you get that social engagement, or you're connecting with nature and kind of have that gratitude and decreasing stress. That's great. If you love to kind of push yourself, there are definitely benefits with high intensity interval training. I would say the high intensity kind of ultra marathon type stuff, that doesn't seem like it's likely providing cognitive benefits long term. I think it tends to deplete mitochondria. And so that's probably
Also
not.
can cause cardiac issues too, right? I mean, there's like, I've seen things that people that run marathons have like heart scarring and end up having heart attacks younger. And just seems like almost too much stress on your body since you're already living in such a stressful world with so many exposure to toxins and things already that are depleting us, right?
Exactly. Yeah. And the same thing with, high intensity exercise in general. If you're living a life where you're constantly stimulated and you wake up a little bit stressed, your brain's already running. When you go to bed, your brain's still running. Sometimes you wake up during the night, so maybe you don't get super restful sleep. And then your exercise is super high intensity. Even though you enjoy it and it kind of gives you a high, your brain never quite gets to come down and relax from that. So those are the people where I have to kind of pull them back a little bit and say, let's add in a few days of maybe at least 2 days a week of kind of calming yoga and maybe add some meditation in with that and see if we can, calm the brain down.
Absolutely. Well, amazing. Well, Dr. Noorda, thank you so much for sharing all this amazing and helpful tips. I really hope this helps people out there on their cognitive journey. And I'd love for you to end by sharing a little bit about your practice if people want to work with you and how you work with people.
Absolutely. And yeah, thank you, Erica. It's been a pleasure.
Thanks.
Went by so fast.
I know it goes by fast, right?
Yeah. So yeah, for sure. So our practice is called Resolve Medical. So you can go to resolvemedical.us is the website. You can follow me, Dr. Scott Noorda, on Instagram. That's where I do most of it. Also on YouTube. We have our Brainlift website as well that you can link to in that resolvemedical.us. just constantly sharing information with people as much as we can as research comes out and we're learning new things and experiences. And I love to share on our reels on Instagram some of the kind of interesting cases that we do from a guess what's happening or guess what's the underlying cause of this person's cognitive decline. So if you enjoy that sort of, if you're nerdy like me and enjoy that sort of like what might be causing this person's dementia, and then see if you kind of relate with that, I think that can be helpful. So yeah, that's what we do. Again, we have a Brainlift program is what we created. We're on gone through multiple iterations of this now and had a whole host of different cohorts of people, and then people coming in individually and just finding significant improvement. We're seeing about 70% of people that are seeing significant cognitive improvement. And what we do, again, is kind of everything we already discussed. We find people's unique kind of red flags and risk factors, and then address those in 6 months. And it's set up virtually, so you can, every day you get a task, and it's basically, again, instead of trying to give somebody the mountain of research to implement right now, it breaks it down. So day by day, there's one thing at a time to do. Starts with nutrition and goes through movement and exercise and detox and stress and sleep and relationships and all the things that are involved. So 5 days a week you do that, and it involves some brain training along with it. And we have health coaches that are trained in this as well, that are just amazing at helping people implement into their unique circumstances what the research is showing. And then we just test along the way and make sure symptomatically things are improving, cognitive scores are improving, and then we adjust as we go. So that's what we do.
All right. Amazing. I love it. So thank you so much for sharing everything. We'll go ahead and link to everything in the show notes as well. And thank you for your time.
Thank you.